In this video, we're going to talk about previewing, a really important strategy that a lot of students miss, but it can save you time and help you learn more effectively. Why preview? The courses move fast. The individual lectures also move very fast. And some students leave classes feeling like they didn't get anything out of it. I've actually heard a lot of students say this. They walk out of a class and say, that was all over my head. None of that made sense. Obviously, that's not a good feeling, and they're very distraught when that happens. And studying is time consuming, so if you need to study more due to not previewing or being lost in class, then you'll probably fall behind and not get to everything that you need to study. So how to? Now, the important thing with previewing is to know that you're not trying to learn all of it, you're not trying to teach yourself all of it, and you're not trying to study all of it. Really what you're doing is you're just getting familiar with the topic and familiar with the lecture materials. So there's a lot of ways you can do it. These are examples. You don't have to do all of this, but you can pick one or two. So one thing you can do is scan the PowerPoints and or textbook. Be mindful of bolded or italicized words, pictures, and tables. So you're looking for important information. This is really good, especially if you're not familiar with the terms, because those terms are going to be really important. If your professor's using those words and you don't know what they mean, it's going to be tough to follow the lecture. Number two, read the PowerPoint titles and chapter objectives. So one thing that I would do as a student is just go through the PowerPoint really quickly and just look at the titles of each slide. And that way you get a sense of what are the main points to this lecture. But you could also read chapter objectives if they have them in the text, or some teachers will put objectives at the beginning of their PowerPoint. Gives you a sense of what you're going to be covering and what to be ready for. If there's a textbook chapter summary, you can read that for an overview. You can scan the text for subheadings and subtopics. So each chapter is going to have the chapter title, but then the subheadings, those are going to give you the most important subtopics to look for. Note and look up unfamiliar vocabulary, especially if you are struggling with the terms. If you don't want to read, you can watch a video, especially for people that are visual. You can watch a 5-minute YouTube video, not 50 minutes, not 5 hours, 5 minutes or thereabouts, because you do want to keep preview relatively brief. As you're going through the material, any questions you have or things that are unclear or confusing, you can write down those questions so that you're ready to ask them in lecture. And this is much more valuable than going into a lecture completely cold and unprepared, because going into lecture with questions means your brain is going to be trained on figuring that out. So you're going to be listening for those answers in lecture, and then of course the teacher's there, so you'll be able to ask the teacher between hours or after class, or even during class. With preview, you do want to move quickly. You're previewing, you're not studying or learning or teaching yourself. Think of it like a movie trailer. The movie trailers aren't meant to tell you all the information, all the characters, the plot, and all of that. It's just giving you a basic overview so that you're going into the movie with some basic understanding. That's how you want to look at previewing these lectures. You're not looking to know everything or memorize everything. You're just getting familiar. And if you don't want to read or watch a video, if that's too passive, you want to do something more active, you can make something. You can make a mind map, concept map, or an outline based on the rough subtopics that will be covered. I knew one student who told me that he was doing this, and for all of his lectures, he was making a broad mind map and then filling it in as he was in class. And so he was taking notes on his mind map. So when he left, he already had this mind map's like a concept map where everything is connected. So he had everything connected and put in its place by the time he was leaving lecture. So he didn't have to study that much. By the time he was finished with that, he had the information in his brain pretty well and just had to rehearse it a couple times before the test. But as far as understanding and grouping things together, which we'll talk about in a future video, he had that down pretty well. Another thing that's really important when you're previewing is to create context. Our brain, when we learn things, we make connections. And so if we're not making connections, it's going to be really tough to learn. If you're learning something in a vacuum, it's not going to happen nearly as well as if you are learning and relating it to other things that you already know. So one way to do this is with context. Let's look at personal context. If you have some sort of personal experience with this body system, with a disease, this could be your personal experience, it could be a professional experience, or maybe you took a class on it in the past. You may have already learned some of this material, and so you can obviously use that to your advantage and use what you already know to learn other things that you don't know yet. Medical context is important, obviously, because these are medical courses. So having a basic understanding where you're at, what organ system are we in, what are the cell types involved, what diseases are we discussing or could come from this organ system or from this particular topic. This is obviously important because you need to know how things fit together. As a doctor, you will want to keep building this medical context over time. And so it starts now with reflecting and thinking about how everything comes together. And if you want to see how things come together, those are the questions you're going to have to ask. How does this come together? Because it moves very fast, and so a lot of things are taught in isolation. And lastly, the significance. Why is this topic important to learn? Why do I need to know this? This serves two functions. One, if you realize it's important, then you may be more motivated to learn it. Two, if you know why it's important, then it can help you learn it that way so that you're prepared that, okay, this is going to help me understand my diabetic patients better. And so if you learn it within that context, then you're more likely to A, remember it, and B, access that information when you need it for that future patient. With preview, it's important to keep it simple. Some preview is better than none, but you can also go too far, so less is often more. That's why I mentioned 5 minutes. And you aren't studying, you aren't learning or teaching yourself, it's preview. You're just getting familiar. You're just meeting this information maybe for the first time, or you're revisiting it for, maybe you've seen it before, but now you're revisiting it for a class. Just get familiar with it. A couple minutes can go a long way. So I recommend 5 minutes. It can be more. It can even be less, but don't go overboard. 15 minutes for an hour-long lecture is probably going to be wasteful. You also, it's not just about preview. You have preview, class, and then review or studying. Preview can save you hours of studying by helping you be more prepared in class. For those students who leave class saying, I got nothing out of it, well, that 1 to 3 hours of lecture was in a way wasted. Because if you're leaving, you don't feel like you got anything out of it, well, you could have been doing something else with your time. With just a little bit of preview, you can go from that to, all right, I didn't pick up everything, but I had a general sense of what was going on. I recognized some of the terms that were reviewed beforehand. I have some questions. Some of my other questions that I came in with were answered. If you're there after class where you're not, you don't know everything perfectly, but you're on your way, you have some questions, you have some understanding, things are getting clearer, that is not only you farther ahead than the person who is completely lost in class, but your studying is going to be a lot easier too, because it's really hard to study from a place of being completely lost. And that's the place that you would have been in preview anyway. So spending a few minutes of preview, getting a bit of a handle, a little familiar, going into class and making class time more useful, that can save you a lot of time on the back end from studying. So the bottom line is preview each lecture for at least 5 minutes is my recommendation. But if you're having a hard time understanding lecture, that means you probably need more preview. If you're in a lecture and you're lost, it means that you need to be a little bit more prepared, probably. Might have to look at the terms, might have to look at the concepts. Maybe reading the text is going to be best, or maybe you just need to focus on the PowerPoint, or perhaps you have to get rid of the words and watch a video so you can get a picture in your mind. That can be really helpful too. And these early investments pay dividends. It's like this with preview. It's also like this with etymology and knowing terms. The more you invest your time efficiently into these strategies, it's going to pay more and more as you go along. And if you think about if a little bit of preview helps you understand class better, and then that helps you understand, helps you study more effectively, and then you learn the material better, it gets in your long-term memory more effectively. Well, now each class you take after this, you're going to be building upon that knowledge. And so the more you learn now, the easier it's going to be to learn in the future. And that's something that I've definitely noticed over the years. It used to take me a long time to learn things that now I consider pretty basic. And now, because again, we had talked about context, the more context you have, the easier it is to learn more stuff. Thankfully, after 4 years of medical school and several years of practice, I have a lot more context than I did before. So now when I'm learning something, it happens much easier than before. So in your first year, your first 2 years, build that context and foundation so that as you go along each year, you study less and it comes more naturally. And keep previewing simple. Like I said, don't try to learn everything. Also, don't try to do everything, and don't be fixated on perfect. You're not looking for perfect for preview. For preview, you're just looking for familiarity. You're just meeting this information for the first time, or saying hello to an old friend you haven't seen in a while, but you're just getting familiar. You're not looking to learn everything. So that's it on preview. Give it a try. If you haven't done it already, give it a shot, and because it can really help you learn more effectively and save time.